My name's Pat Heintz. I live here in Traverse City with my wife Leslie, where we raised our 4 children, and I've practiced law here for 40 years. My law partner, Doug Bishop, graduated from the Naval Academy, and he organized a trip for a bunch of us guys. And there were several of us to go to the Army-Navy game in Philadelphia on December the 14th. And so that morning we were having breakfast. We hadn't even ordered yet. And one of my good buddies was sitting across the table from me, and he said, "You're having a stroke." And I thought he was teasing me because I had no feeling, no sensation of it at all. And I was drooling out the left side of my mouth, coffee and water, and I couldn't sit up straight. I was just leaning over. My whole demeanor changed. He was exercising that be fast test. He looked at me and he saw my face was not correct, and I couldn't pick up my left arm. They said, "Smile and stick out your tongue," and I couldn't do either one of those to speak of. And so they immediately called 911, and we were right within the shadow of the Thomas Jefferson University Neuroscience Department. And they rushed me there with an ambulance. I was fortunate enough to be very close because every minute matters when you're having a stroke. The most significant impacts have been my impaired left leg and impaired left arm. I need to walk with a cane now, and I have to have a brace on my left shoulder because of the subluxation that developed so that it stays in place. But I'm making great progress with therapy. I was always very active. I was a jogger. I jogged Clinch Park 3 times that week before I went to Philadelphia. The doctor advised my wife that this had been progressing for a long time with plaque buildup in my carotid artery. That's what caused the stroke, and she told my wife that I had one of the worst strokes you could possibly have. Had I had my stroke here locally, I probably would have been transported down to a facility downstate and lost precious time and not have had the type of recovery that I've enjoyed because they were able to attend to me immediately and address those needs with that equipment. That's what we need here at Munson. This is a world-class group of people, and we have state-of-the-art systems and they need updated. With your help, Munson Medical Center will become one of 2 facilities in the country that will have these biplane interventional radiology devices that are state-of-the-art that will immediately help our team provide the patients with treatment that they need to survive and excel after a stroke incident. And with your help and your gift, you'll be able to make sure that our loved ones and families and friends are going to get the state-of-the-art treatment should the unthinkable happen to them here in northern Michigan.